You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. No more dentures. Get a brand new upper and lower set of teeth supported by dental implants. With us, we have Dr. John Rutledge. Dr. Rutledge, welcome to the program.
Hi, Randy. Glad to be here. Thank you.
Now, you brought some photos, so we'll get to as many of those as possible. But first off, who's the typical implant patient that you see?
So one is the patient that comes in that has basically teeth that they've been told they have to all be extracted. They're at the end point of their dentition, and they just know that it's the end of the line and they need to have their teeth removed. They come to us and we place dental implants, and we place teeth on those implants that don't come out. They're fixed in place and they can eat what they want to eat. The other subset of patients are patients that currently have a denture that are just sick and tired of having a denture. They're tired of, the denture flopping around when they're trying to eat a steak or bite into a piece of broccoli, eat a salad. They're just frustrated. So same thing with those patients. We'll place dental implants, and they have a set of teeth, upper and lower. Oftentimes
They don't come out.
They don't come out. It's amazing, but they can.
Now, you say that the denture wearers don't seem to come in for this, and you could help them the most. What do you mean?
Yeah, because those are the patients that they think it's the end of the line. They put that dental history behind them. They thought that all my teeth have been extracted, so I'm never having to go back to the dentist, and they don't even know they have an option. So it's challenging to get them in because they don't even know that the dental implants and fixed teeth that are fixed to the implants
when
aren't
you
even
give
an option.
people like a full upper and lower set of teeth back supported by dental implants, you say they want to hug you sometimes.
Yeah.
Really?
Can you imagine? Can you imagine hugging a dentist, Randy?
No.
It's kind of weird, I know, but it's very rare. When I do a skin graft for someone, or maybe extract one of their teeth, that I get a hug. But with these procedures, when I can place implants and then have a fixed set of teeth on those implants, the teeth are not removable and they can do what they want. They hug me.
That's nice.
It's one of the most one of the greatest things about my job doing these procedures is actually at the end of the surgery that we have to place the implants, most patients have teeth the same day, fixed teeth the same day, and
When
very
you say
often.
fixed teeth that don't come out.
Exactly.
Okay.
Yeah.
Okay.
So they're not a denture. They're not taking them out at night to clean. They're not coming out when they laugh, or it's they're fixed in place.
And you say they could be like 80s, 90s in doing this?
For sure. Actually, I had a gentleman come in, 93 years old, that had a big bridge that had lots of cavities, lots of.
Why would a 90-year-old want to do this?
Why not? You think about it, all of us, eating and smiling is such a big part of our lives, but even more so when you're 80, 90 years old, it's really a huge focus of your life, going out with your friends, having your grandkids bring you, food. It's just, it's a huge part of our lives is eating. But, why wouldn't someone at 80 or 90 years old, even 100, why wouldn't, they deserve to be able to eat and smile just like you and I do.
Now, I interrupted you. You were telling me the story about the 90-plus-year-old. So what'd you do for him?
Yeah, so we ended up removing his teeth and placing implants, and it's just, before he couldn't bite into anything on that side. It was painful, and this whole bridge work, it was loose because there was cavities down to, approaching the bone. The infection had eaten away the tooth structure, and the bridge was, wiggling in the wind. So, we placed the implants, and he has a fixed bridge in that area, so teeth that aren't coming out, so he can enjoy food and eat with confidence again, and he's not in pain.
Okay. Now, are there a lot of people in Nebraska as a state that are either wearing a denture or headed for a denture? I mean, is it a big problem?
Yeah. So according to figures from the American College of Prosthodontists, you could fill Memorial Stadium over 2 times with people that have no teeth in just Nebraska alone, Randy.
Is that right?
It's,
Okay.
it's a huge problem. That doesn't even take into account, how many people are, at the end game of their current teeth that, that may need to have the rest of their teeth extracted. But yeah, purely.
So it's a big problem.
Yeah.
Well, if it's so good, look, getting new teeth supported by dental implants, if it's so good, and you could be even in your 80s, 90s, whatever, why aren't they all doing it? What's your take?
Yeah. My take, number one is they have a denture and they don't think they need to go to the dentist. If you
So they don't know their options.
Yeah, they think you have a denture. It was a traumatic thing, potentially when they had all their teeth removed. It was a lifetime of dental stressors. They had every time they went to the dentist, they had more cavities. They had potentially periodontal disease.
A lot of money too.
Yeah, so for some people it feels like a money pit. They've invested so much money, and every time they go, it's another $1,000, $2,000, $5,000. Another root canal, another extraction, another crown. So I think a lot of people that have to have all their teeth removed. There's so many things we can do now, and at our office, we give you all your options. It may be that you need your teeth removed, and we can do a denture that snaps in and snaps out. We also can do implants and have teeth attached directly to the implants that don't come in and out. So there's multiple things that can be done, but I think one of the big reasons people aren't coming in is because, number one, they don't know their options. Number two, that chapter in their life is behind them, and they don't want to revisit a dentist. In a way, they're relieved, I think, that they don't have to go to the dentist, or they don't think they need to go to the dentist. Where in fact we have ways, to help them so much now.
You're big on sedation, right? So these people, they're numbed up, they don't feel anything, and they're sedation.
Exactly.
Taking
So
sedation.
the fear of pain with the dentist, it is a real thing, and I've had lots of patients tell me that they've had horrible experiences 50 years ago at the dentist, and it's just there's really no reason today that we should have patients that have a bad experience due to anxiety or discomfort at the dentist. I like to take people, in my initial consultation, I try to read them and take them where they're at, ask them questions, and say, where in the spectrum of sedation do we need to be? How relaxed do you need to be for the procedure? We can do something as simple as nitrous oxide. We can use oral sedation. We can use intravenous sedation. Oftentimes for the intravenous sedation, I'll even bring in a nurse anesthetist into the office.
Okay.
And I'm certified to do IV sedation myself, but I just find it's just so helpful to have
Somebody else watching their vital signs?
Yeah, they're monitoring vital signs, but also administering the drugs. So it really allows me to be the completely focused. Doing the surgery in their mouth. The anesthetist can be running the whole sedation.
And with the IV sedation, you can pull them out of it quicker than you could with just the pill.
Exactly.
Is that right?
Exactly. So the half-life of the drugs are shorter with IV sedation versus the oral sedation. With any kind of sedation, you want to be monitored the rest of that day.
Is it true they don't have, I think you told me this, very little memory. Like you gave them upper and lower teeth that don't come out, and they don't even remember the procedure.
Yeah, it's a beautiful thing. We actually call it retrograde amnesia. It sounds like fun, doesn't it, Randy?
Yeah.
I wish I had that with some of the messes my kids have made at home, but that class of drugs that we use for oral sedation and for intravenous sedation, and it causes you to forget things. So which is kind of nice when you're going to the dentist. So
yeah, but if you've been wearing a denture for like 10 or 15 years, is it true you don't have enough bone to do this?
No, actually. Maybe 20 years ago that was true without the technology that we have. Nowadays we have CT scans that can show us bone down to fractions of a millimeter. We have computer-guided surgery that allows us to plan things like we never had before, and 3D printing of surgical guides. So the bone.
So you have printers in your office?
We do.
Is that right?
We do.
Okay.
For some of our cases, we'll use actually a 3D printer. For our simpler cases, we'll actually have them, I plan them myself in a computer, and we print them out using a medical grade 3D printer, and they're used during surgery for some of our cases. For other larger cases, I'll outsource those, and we'll they're actually 3D printed out of metal, the ones that I outsource.
Very nice.
So it's technology it's a beautiful thing. It's an exciting time to be a dentist and exciting time to be in dentistry, but also really for patients, it's a great time to need these more complicated procedures. You know, the planning that we can do using the digital planning we can do, it really makes the procedures much more accurate than they were even 5 to 10 years ago when we were not using that technology, but it makes the procedures also more efficient. You don't want to sit in the dental chair any longer.
So it's faster.
Yeah,
Everything's faster.
You don't want to sit there any longer than you have to.
So people watching this with really bad teeth and gums, they don't have to switch dentists if they love their dentist. You work together as a team. How so?
Exactly. So we just work hand in hand. The majority of patients that I see, they already have a dentist that they're comfortable with, and we work with them. We do the surgical phase of the treatment, and they do the prosthetic or the making the teeth on top of the implants. So definitely no worries if you have a dentist that you love, you can stick with them.
Now you brought some photos, and these are I should mention, people that are just tuning in, we're talking about getting a brand new upper and lower set of teeth supported by dental implants. With us we have Nebraska's go-to periodontist, implantologist when you're considering getting a brand new set of teeth, Dr. Rutledge. These photos, I'm not trying to side with you here, but these are pretty dramatic photos.
Yeah.
So let's take a look.
Yeah, these are exciting. So this first one is one of my favorites, actually. She came in and she didn't like the black areas around her teeth. Those black areas are cavities. It's an infection that's eating away. Oftentimes those teeth will just start to break away when people are eating. Very often people will say, they'll bring a tooth in hand actually and say, this came out, yesterday at lunch.
So was she headed for a denture?
For sure. So before dental implants, she would have had a full upper and lower denture, and in her case too, there was also underlying gum disease or periodontal disease. It's a separate infection from cavities, but it's a chronic infection that eats away at the bone. That's been shown to give you increased risk for heart attack and stroke. Okay. So it's but in her case, when we were able to remove that infection on her teeth, but also remove the infection in the bone, very often after these procedures are completed, these patients are coming back and they're telling me, something's different. I feel
better.
I feel better.
Because you wiped out the infection?
Yeah, and it's something I wish I could somehow measure it, quantify it, and tell each person like how much they're going to feel better. But I had an attorney come in recently, and he very severe periodontal disease. He was heading for a denture, but he decided to place the implants and have teeth that were attached to those implants. But he couldn't get over and tell me enough times how much better he felt after this was done. And once he really told me over and over and over, it hit home, and it made me think, this is something I need to be talking to people about. I've read the studies, and I know that this gives you a higher risk for heart attack and stroke, having this
infection in the mouth.
Yeah, this chronic infection.
So you clear it up.
Yeah.
You can't brush it. And we talked about this in the green room. That in fact, you said you don't judge these patients. That means it's not that if you have this infection, you can't brush and gargle and floss it out.
Yeah. So when a patient like this, or these future photos I'm going to show you in a minute here, I just want people to know that you aren't judged when you come to our practice, because we know that periodontal disease is caused by bacteria. It's an infection, but we also know that a lot of this is genetic. So no matter how much you brush your teeth, you could brush your teeth 10 times a day, Randy.
Is that right?
You wouldn't have the time to do it, but if you did, in most cases, it's not going to help.
So what did you do for her?
So in her case, we gave her an upper set of teeth. They don't come out, but you can see
looks good.
Just the difference between the before and after of how, number one, just the color, the shade of the teeth, much lighter, much more, would you say she looks younger in the after picture?
Yeah, that's true.
The teeth, they fill her smile nicely. They're, you don't have these black corners on the sides. The length is just beautiful. What's interesting about this case is, this is just the upper. She needs the same thing on the lower jaw. So she's hopefully in the near future, going to be doing the same procedure on the lower jaw. So, but you can see just doing the upper teeth, what a difference it really makes.
They look real.
Yeah, they do. I would.
Is this designed by a computer? Some of this?
It is. It is. So
Based on her face?
exactly. So we go into great detail. It's not a a random thing how we get a smile to look like this. We talk about, before we place the implants even, we talk about the color of the teeth. We talk about the shape of the teeth. I ask people, what do they like about their smile? Because there are certain things, that people really like, even if they have to have all their teeth removed. There's certain things that they really do like about their smile. So we'll keep those things.
So it's customized.
Yeah, we'll keep the things that you like and get rid of the things you don't like. So it's an exciting thing.
What's it like when they look at themselves in the mirror for the first time?
At the end of this procedure, it's one of my favorite things actually that I do any given day, Randy, is when I get to give them the mirror and they look in the mirror, and the majority of patients, there's a tear in their eye, literally a tear. And my assistant that usually assists me with these cases, that's her favorite thing too. He just, I should videotape it if I had permission from a patient, but it's just it's a beautiful thing to see them just, their new smile for the first time, taking away all those things they don't like. It's really,
what do they like more? Do they like the appearance? Because you said people with bad teeth, it's tough for them to chew things like, almonds or chewy things like pizza or whatever. Do they like the eating or do they like the way it looks?
Yeah, it goes both ways, but I think I've never had a patient that came in just for aesthetics that now is complaining to me that they can now eat ribs or corn on the cob or bite into an apple. So really, I think they're checking both boxes. They love that they have a beautiful smile, but they also love that they can eat whatever's on the menu.
Whatever they want.
The life of a denture wearer, if you have a denture, Randy, it's just, you have beautiful teeth. You'll never have dentures, but it's just, it's something that unless you've had a denture, when you look at that menu, patients start to sweat sometimes. They look and they think, I'm out with my friends. What can I eat? This is
because their teeth are so bad they can't eat certain things.
Yeah. Things that are hard things, crunchy things, can be very difficult to eat with a denture. So that huge menu at Cheesecake Factory that about short circuits my brain every time I see it.
Yeah.
For them, it's not so big. It's not a book. Maybe the omelet, but are you gonna have an omelet for lunch every time you go out with your friends? I don't think that's the most favorite food for anyone. So
they can eat whatever they want.
Yeah, they can eat whatever they want and enjoy foods again. And the nice thing too, it doesn't cover the palate. A traditional denture is going to cover the entire roof of your mouth, the palate, and that changes the way things taste, and it makes things, it just takes away the vibrancy of food. So, and some people can't even tolerate that palate, being covered, causes a gag reflex, and so
with the implanted teeth, the roof of the mouth for hot things, cold things, spices, is uncovered.
Exactly.
Okay.
So when we place implants and you have teeth that are attached directly to those implants, teeth that don't come out, the whole palate is open to give you that give you that feeling of that taste back again, but also preventing that gag reflex of having a denture way back in the back of your throat. So I'm going to show you another patient here.
Okay.
Ready? Let me show you this. This is a fun case. She came in. Beautiful smile, beautiful high smile. It's something that we actually look at very closely before we do anything, is where your lip line is. So you can't, you can't train a lip to go to that position. Hers just naturally goes high. So, some people are more low, some people are high. She has a high smile, but the problem is, you can see in between the teeth, she's had so much bone loss.
What is that?
Yeah, we call them black triangles. So it's just actually air spaces in between her teeth, but it's because she's had such severe periodontal disease, gum infection. The bone has shrunk, has risen up, and now you don't see the gum tissue. All you see is the teeth. So really, a perfect smile, Randy, is a combination of pink and white. So the white are the teeth, and the pink are the gums. The gum tissue really frames the teeth.
Okay.
But with periodontal disease, especially in her case, when the gums shrink up so much, there's something, when you look at that smile that it's just not right. So her option was a full denture, and she absolutely wasn't going to go to a full upper denture. She didn't want her palate covered. She instead elected to have implants placed and teeth attached directly to those implants that were not removable. And you can see her after photo is just it's really a showstopper. And I would challenge anyone to say, look at that smile and say those aren't just perfectly natural teeth. I think that's how good it looks. She has an interesting story too. She is a nurse, and she brought in a picture when she graduated from nursing school and said, Dr. Rutledge, this is what I want. This is when I love my smile. This is what I want to look like. So I looked at that, and we used that in our planning
to make the teeth.
To make her final teeth. So I love when people do that. It's just it's exciting to have a good close-up picture that we can use as a reference and try to copy, duplicate everything she likes about her smile.
Now, one of the things that you were telling me is that most of the patients you see have hated their teeth. Maybe hate's a strong word, but not like their teeth for 10, 15 years. They put it off and put it off and put it off. Is this one of those things where they go, I should have done this years ago? Like she went years possibly not liking her smile.
Yeah, that's usually the biggest complaint I get. It's not, cost, or it's not discomfort. It's the biggest complaint is I'm mad at myself for not doing this 5 years ago or 10 years ago, because this was actually easier than I was expecting it to be. It was.
Do they say that?
They do. It blows me away. I probably get more complaints from patients when I extract a single tooth than when I do these larger cases. It's amazing, actually. So the biggest complaint, not doing it soon enough. So if this is something you're considering, I would give us a call, come in. We have a complimentary initial exam consultation and a
so you'll let them know their options right there.
Yeah, and we'll take a CT scan.
So no more dentures. At the very top of the show, we said no more dentures. Is that your goal? That like nobody should be wearing a loose-fitting denture? They should either have teeth that are snapped in, snapped out, supported by implants, or upper and lower teeth that don't come out, supported by implants.
Yes, absolutely.
Can you wipe it out in Nebraska? Are there enough dentists? If everybody figured out how good this was, are there even enough dentists to handle this?
No, not even close. There's so much work to go around, Randy. It's we'd have to start 5 more dental schools in Nebraska. There's such a need for this.
Okay.
Yeah, but you're exactly right. I think the goal is to have people that either have especially a lower denture can be so frustrating for patients. Sometimes I think there's more lower dentures in people's nightstand drawers than than in their mouths, actually, because especially a lower denture, there's no palate to suction against, so the stability of a lower denture is very, very low.
So at least start there.
Yeah.
Get a lower set of teeth supported, fixed by dental implants.
Exactly.
Good. Time for one more photo. I'm sorry to rush you.
No problem. So another patient, great case. Her option was denture or implants with teeth that are connected directly to the implants. She elected to go with the implants, and she is just overjoyed.
Looks good.
Yeah. In her case, what really sticks out to me is she was a very happy person to begin with, but you can just see how her smile is amplified in the after picture.
That's
just
true.
Smiling more confidence. You can see her eyes they're lighting up. So it's great case.
And they look real. Look, I think anybody watching this at home could see that these look real. Going into this interview, I think I told you, I could spot fake teeth walking down the street. These look real.
Yeah.
So that's because you're doing it on a computer, planning things on a computer.
Yeah, that's part of it. Planning, but also in the computer, but also talking to the patient and seeing what they want to keep, making sure the shade's right
And now
the
she can
shape
eat
is
whatever,
right.
salads. Could she bite hard things like a carrot with her front teeth, or that she has to be careful about?
Yeah, most definitely.
So it doesn't matter.
Carrots, apples, ribs, steak, broccoli. She can eat with confidence. Her teeth aren't going to move. They're fixed in place. Last photo here, Randy. This is another great case where missing multiple teeth, option, denture, but she doesn't want a removable denture. She wants teeth that are attached to implants. So we ended up extracting the teeth, placing implants, and looking at the before and after. Randy, would you say she looks younger?
She does. More sophisticated too.
Yeah, it's just the confidence she has in her smile. The before and after to me is just and she is one of my most appreciative patients too. She actually gives me these little chocolates for Christmas. I'm like, I just noticed this thing appeared on my desk one day, and I'm like, well, that was very nice of her. So it's not only do I get hugs, Randy, sometimes, but I actually get chocolate after these. So
Do they? I think you told me this, that sometimes they go through the procedure and then they come in for their follow-ups or whatever, and you don't even recognize them because they act so differently. Is that right?
Yeah, well, great story about, I have a patient that had this procedure done where he had 35 years old. We extracted all of his teeth because they were such severe cavities. It was either a denture or some sort of implants with fixed teeth. So we decided, in his case, to do the fixed option, 6 implants, fixed teeth. But
fixed teeth mean they don't come out.
Exactly.
Okay,
so
okay.
The teeth are attached to the implants. They're not coming out. One of my staff members is big into social media, which I really don't have time or energy for. But she saw him on Facebook a month or so after this procedure was done, and she said, "It was amazing. I saw him, and he was with his daughter at a heavy metal concert, smiling and showing all of his teeth." And she said, "I didn't see a single picture before this was done that he was smiling at all." So, it makes me almost want to look at Facebook, but still don't have time to do
Very
that.
nice, very nice. So people start doing selfies and things like that. They're proud of their smile.
Exactly.
Smiling all over time. We're out of time. Final message to the 2 groups we're talking about today, which is the patient that still has teeth, but they're so bad they're probably going to have to be removed, and their option is a denture. And then you have the people that are currently wearing dentures. Let's say they've heard what you have to say, but they're still skeptical or afraid or worried. What do you say to them?
I just invite them in, come to our office. We offer complimentary CT scan, initial exam, and we'll take a look, and we'll look at your options. It's an easy thing to do. Come on in and talk to us.
Get in there. Now, we have to mention insurance. Medicaid, Medicare doesn't really cover this at all. The best dental insurance max payout might be $1,000 to $2,000, but people are financing this. Is that right? Across the country, not just your office.
Yeah, it's very common. We can get down, into very affordable payments, more like car payments instead of house payments. For something that's life-changing like this, can be made into very manageable payments. People are financing very commonly, so we have lots of options.
Well, look, thank you for the time. Great information. This stuff they can find on their website. Do you prefer they call your office, or can they go to the website and make an appointment?
Probably the easiest thing, Randy, just give us a call, and we'll take it from there.
All right. Dr. Rutledge, thank you for coming to the show. Good stuff.
I appreciate it. Thanks, Randy.
All right. You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.